Hi, my name is Kimberly Mann on the behalf of expertvillage.com. In this segment, we're going to be talking about the lower region in the back where a lot of people get a lot of chronic soreness due to their line of work. And also, when you do this, you have to make sure, again, you're really going slow in a Swedish mode. So, because this is a very tender, very soft area, a lot of people have problems. So what you really want to make sure is you as the therapist or any amateurs who are willing to do this, you really have to make sure that you are standing properly yourself. Right foot, if you're on this side of the table, make sure your right foot is in front and the left foot is in back. So you're hugging the table and you're leaning into it so you don't hurt yourself. And what you do to one side, you must do to the other side. And again, this is the lower part of the kidneys. You have to really make sure, again, you go really in a long Swedish. Some people who do Swedish, it's very light. You can lean a little heavier. And by doing that, use the heel of your hand. So this is what it's going to look like. Up and continue. So again, we're warming up the muscle, so everything else is getting an overall haul. So what you do, you kind of want to circulate the massage, so you're not neglecting one part that even though you did the area already, you kind of just want to do an overall. So what you do to one side, you must do to the other. And you can do it at the same time, like so. Come back and forth. This is a medium pressure by leaning into it. By deep tissue, you want to now, since we've been doing this, you kind of want to use your arm, hug the table, make sure you're not hurting yourself, so you don't torque your body out of position. So you use your arm, make sure you don't rub up against or over the spine, that's this part here. So make sure you're doing it carefully, not leaning to a point where you're hurting the client.